Hey guys, Ashley with Amare. So today we're here to talk about lymphedema. So obviously the word lymphedema has to do with the lymph system, but what is it? So a lot of people get lymphedema after cancer. It's very well known in the cancer community. Some people are born with lymphedema. A lot of people, when they're older, they kind of develop lymphedema. So it can happen at any stage in life, but what is it? So lymphedema is just a word for lymph swelling. All it means is like super excessive swelling. The mildest form of it is like maybe in the summer when your ankles blow up or when your legs swell in the summer. That's a very, very mild form of lymphedema. A very extreme form of lymphedema is after breast cancer. If they remove lymph nodes, your whole limb will blow up. Or if you're born without lymph nodes, which some people are, the whole limb blows up from a very young age. So there are two kinds of lymphedema. There's primary and secondary. Primary is where you're born without certain parts of your lymph system, so your body doesn't process out that fluid. Now, we know that lymph fluid is made up of proteins, white blood cells, fats, and water. It's primarily water. It's all it is. So if you're not drinking a lot of water, it's going to get stagnant. But a lot of people with primary lymphedema have a problem where that water just leaks out into the body. It gets in between the space of the skin and the tissue, right in between. So that's usually where the lymph vessels are, is in the tissue and just below the skin. But if they're born without them and they're born without lymph nodes, the fluid's got nowhere to go. So that's what causes primary lymphedema. Secondary lymphedema is caused by a manual break in the system. So either an accident or a scar or an injury, something like cancer, where they're removing the nodes altogether. I know a lot of people after plastic surgery, like we talk about all the time, they get a form of edema or swelling because they had surgery. So they got cut open, and that's what that is. So edema, lymphedema. It's all part of the same thing. So edema is just a word for excessive swelling. If you look on the back of a lot of medications, birth control is a very popular one. A lot of different things that can cause edema, which is just extreme amount of swelling that happens from the lymph system. Lymphedema. So it's swelling of the lymph. That's a lot. There are a bunch of things that we can do to keep this under control. So like I said, something as simple as your ankles swelling up in the summer, they usually tell you to elevate your legs, right? Because the lymph system only has little vessels that pump the fluid. It's an open system, as we talked about in our first video about what is the lymph system and what is lymphatic drainage. So with the lymph system, it can't just kind of funnel like your circulatory system. It needs to be pumped. So a lot of times walking helps, keeping your legs elevated because it'll go with gravity helps, a lot of that. There's also compression that you can get. So compression is our number one best friend when we're talking about any form of lymphedema. So simple compression stocks or stockings or leggings or something that gives you that good medical grade compression. Now I know there are a lot of compression things out there on the market. You can get them in CVS, Walgreens, Target, as seen on TV, all these different things. But a lot of that compression is not medical grade. Medical grade compression is tighter on the bottom and looser on the top, and it's actually graded medically, and you usually get fit for it, so it fits you properly by a professional lymphedema fitter or a garment fitter, compression fitter. There are lots of them that you can find on the internet, different medical garment companies. That's something we'll go over in another video. But talking about something simple like your ankle swelling up, lots of water, no salt, things that we know that help the lymph system instead of hindering it. Obviously, the heat's going to make it expand naturally, so we want to try and stay cool during that time. Now, that's just somebody with, swollen ankles. It also happens during pregnancy, called preeclampsia. It's due to a hormonal thing happening. We're making a baby, so the hormones go a little awry, and it tells the body to send out more lymph fluid than it really needs. So it kind of gets stuck in the legs. The legs swell up, the face swells up, the arms swell up, kind of the whole body, because we're needing all of that lymph fluid, all of those proteins, white blood cells, fats, and water to help produce the baby, and that's kind of what the baby floats in, is all of that fluid. So your body's going to be producing more. And again, compression can absolutely help. So those are secondary lymphedema things. Someone with primary lymphedema, we can usually treat it with 1, lymphatic drainage regularly, 2, lots of movement, healthy lymph movement like swimming or yoga, things like that we'll talk about in a later video as well. And then, of course, a very, very good compression. Someone with lymphedema would usually go to like a physical therapist, or it starts with a vascular surgeon and they send you to physical therapy and they do like a little bit of like this, where they're just kind of raking over your skin, or most famously known, they give you the pump. Everyone hates the pump. All of our lymphedema clients hate the pump. It squeezes too tight. Again, remember those lymph vessels are only a hair thick. So if you're squeezing that tight and adding that kind of pressure, it's not really moving your lymph fluid. It's just squeezing your leg. People with lymphedema, their skin is already very stretched, and adding that kind of pressure can be really painful and actually do the opposite as far as your lymph goes. So we always want to make sure that our compression is proper for our lymphedema patients, that we're getting manual lymph drainage, we're moving the lymph throughout the body, we're having lots of water, we're not having medications that have side effects of lymphedema. There's tons of things that we can do for treatment. Usually insurance companies will give you the pump because it's a machine and it's manual where it's pumping the body, but again, it can sometimes be a little too rough. I know you can control the speed, the pressure, things like that. So if you do have a machine, make sure it's not squeezing you and it's actually pumping. They usually say to do that 2 to 3 times a day. I know that can seem a little bit excessive, which is why we say come in for manual lymph drainage. Having an actual certified manual lymphatic drainage specialist who specializes in lymphedema can be a huge resource. Ask around at your physical therapist's office, your doctor's office, Google, see if you can find someone, because that really is the key. In our sessions when we're dealing with lymphedema, we go over nutrition, we go over movement, we go over what's causing the flare up. So let's talk about flare-ups. A lot of times people think they're having a flare-up. It's actually several flare-ups over and over and over. So having too much salt can cause this. Having not enough water can cause this. All the things we've already stated. So what happens during a flare-up? What does a lymphedema flare-up look like? One of many things. So like when your ankles swell in the summer, it can get really big and then it gets beyond that. So then you can start to get hard limbs as your legs or your arms. It can start to break the skin. You have what's called weeping wounds. Think about like a cold sore, just a lot bigger. And that usually happens because the skin is so thin that every time you have a flare up or your body throws fluid out into your system and it goes down to where that limb is or wherever it's pooled, it breaks the skin open. And then you start to get what's called a weeping wound. Sometimes it's blood, most of the times it's that clear white fluid that comes out. So when you pop a pimple, you have a little bit of pus, a little bit of blood, but then that pimple usually gets covered over by like this white crusty fluid. That's the same thing that comes out of the weeping wounds. That's all lymph fluid. What your body's trying to do is patch up that skin and patch up that hole so that it's not exposed. But there's so much lymph fluid behind it and it's so big that it's bursting out. So weeping wounds, which is also the same as bed sores sometimes from not having enough movement, like really flaky, cracked skin, sometimes discoloration and bubbles on the skin. So like it'll look like tiny pimples or even big welts sometimes. It can range, but also having that purple discolored skin. We do have on our Instagram a couple examples of that. We will be posting some more quite soon so that you guys can kind of see what that looks like in the progression of what it looks like when it's treated and what it looks like when it's untreated. Again, a lot of times you'll go to a wound center, a wound care place, and they'll tell you you have lymphedema. They'll take care of your wounds, but they don't really do much for the actual manual lymph drainage that you need. So for lymphedema, I definitely suggest looking for a trained lymphatic professional in your area. There are a lot of good resources online on Google. I hope this really helped you guys. If you need anything, please DM, email, call, check out our website. If you have more questions about lymphedema, we'll have a couple more videos coming soon, kind of giving you an idea of what garments, what tools, what things you can use more for managing your lymphedema, what we use currently in the office, the exact brands of what we use, things that can really help. So stay tuned for more, and I hope to see you guys soon. Bye.